First, I'd like to kind of hear kind of big picture, what excites you most about the field of genomics?
We really think genotyping, sequencing the genome, is the first step for precision medicine. So imagine how useful it's gonna be for physicians like we are, in this new tool for clinical decision making. Imagine with one test we can know all the risks of having many diseases, and imagine you have a tool of what we call the pharmacogenetics, to really tailor the best treatment for a single patient. I think this is going to be a game changer.
So could you tell us a little bit about what specifically you've done, and I guess a little bit of the reasoning for why you've decided to do that?
And for several years we've been offering genetic tests to our patients, so basically monogenic diseases that affects few people. But nowadays with these new tests we have available, we're talking about polygenic risk scoring, for example. It's about how probably a single mutation doesn't mean anything, but if you join together all these mutations, these are a powerful tool to risk prediction. So for example, we are using this polygenic risk scoring are really useful for mass stratification, for mass screening. We can check all our population knowing exactly the risk of the most prevalent diseases. If they need a treatment, we can really tailor the treatment. We can nail the best statin to avoid myopathy, or if the customer needs an antiplatelet drug, we know which is the best one. So this is why we choose starting with this project. For the doctor side, it's really useful having this new tool to better stratify the patient, and of course the genetic data, to pharmacogenetic data, to better tailor the treatment. So for the first time, the experience for both customers and doctors are really good. But the initial results are really good, because we've seen that 20% of people with previous low cardiovascular risk, with the results of the polygenic risk scores, we see that they really have a high risk. So for this 20% of people, now we can start what you were talking about. Now we can adapt the prevention plan to avoid having a heart attack.